Thank you very much, Presiding Officer. And having spoken a little bit about the issue around primary care in my contribution during the Programme for Government debate, and indeed speaking about it during a health debate that we held prior to the summer recess, I thank Jim Hume for bringing the issue back to the Chamber. I'm interested by the comments around workload, and one of the things that I've spoken about in the Chamber in the past, and Malcolm Chisholm alluded to it, is how we can perhaps better align primary care services to perhaps reduce GP workload by having people being appropriately triaged to other services where that is the more appropriate place for their conditions to be dealt with. And some GP practices, I know from my own constituency, are doing that. They're speaking to people at the point they request an appointment and are redirecting them to, for example, pharmacy, if that is the more appropriate place for them to be seen. Some GP services, I don't think, do that yet, and that may be a contributing factor to some of the workload issue. Certainly, a percentage of the workload may be able to be redirected elsewhere and dealt with in a different environment. I think the issue around how we utilise other primary care professionals, I think, is something that does need to be examined, and I'm confident that through the work that the Scottish Government is undertaking to look at redesigning how primary care is delivered, that will happen. And there are good practice examples out there. The Minister will be very familiar with the Middlefield Healthy House in Aberdeen, and an example, I think, of good practice and good use of nurse practitioner services, which could perhaps be remodelled in other areas depending on circumstances. I think the point that my colleague Rod Campbell raised in his intervention around pensions is actually relevant to this, and the conversations I've been having locally with GPs, particularly those GPs in their mid to late 50s, suggest that that is a decision that they are now facing as to whether they continue to work in general practice and take the pension hit that will follow as a result, or retire early in order to benefit from their pension as a result of the changes that have been brought in by the UK Government. And that is not a decision that one would want those GPs to have to be facing, but there is a financial element to the decisions that they now face in terms of retirement. We also have to think, I think, look at the fact that the makeup of the GP workforce has changed over time. It used to be a predominantly male full-time workforce. It is now a predominantly female part-time workforce, and there are a number of reasons behind that which probably don't have time to go into in detail. But one, and I acknowledge that you shake your head at that point, Presiding Officer, don't worry, I wasn't going to go into detail. But one of the things I think that does need to be looked at is how GP services are structured to deal with that change in the workforce, but also how we attract graduates in, and that's a point that's been raised on a couple of sides of the Chamber. And some of the discussion that I've had with medical students and medical student representatives has been the question of partnership has been a decisive factor for many in making their decision. I agree with the point that Dr. Murray makes about it being also about specialisms being perhaps more attractive, but also I think the view that there may be a requirement to take on the role of partnership and not feeling that that's something that graduates would want to do. That's why I think looking at a confederated model where perhaps practices control a number of premises rather than one individual premise, so you could have perhaps a smaller cohort of partners but operating a number of practices where you could then employ those GPs, is something that needs to be examined, and I know is being examined certainly by the Health Board in Grampian. So I think there are a number of things that can be done. I think the Programme for Government makes some encouraging signs towards those reforms that are taking place, and I'm sure that that will help in addressing some of the issues that we do face in our general practices at the moment.